All right, we should be rolling.
All right.
So take two.
Take two.
So we want to start all the way back to the beginning as far as
Yeah. We don't have to get, I don't think we have to get into the TP, but again,
yeah,
maybe
just very reset the whole thing.
let's just reset the whole thing. Yeah.
Um, no, we talked about hopping on here today and having more conversation around what we treat, what acupuncture can be helpful for, and answering the question of, yeah, like why would I come in for treatment or why would I seek acupuncture as a help or an assist with your health goals? Lots of different ways to, I think, approach that question, but it is one that we get a lot through the tea shop. People come in and find out we're acupuncturists and are just, oh, well, what is that helpful for? And so, yeah, like, oh, we answer that question. Take tea is more awkward than take.
We need little flags though in the background. Hey, little hand signals like you're in the batter's box. Um,
Say this already. Oh my goodness.
no. So on the first take of this that you probably will never see, we talked about the tea shop and how good it is at bringing people in and getting to meet our community and talk to people and chat people up. And yes, as they figure out we're acupuncturists, there always is some curiosity there. They usually, most people have something going on health wise, or they have a family member, somebody who also may have something going on health wise. And so it always, what we love about running the tea shop on the weekends is the conversations we get to have with folks. And one of the common questions is, why would I get acupuncture? Or I always talk about the pain relief. The pain is usually the ticket in the door. People usually come in for some knee pain or some shoulder pain or some back pain or headaches or those types of things. And we're very good with the pain, but there's a lot of other things that we treat in the clinic on the regular that's, not necessarily about pain. But one topic I think we talked about getting into today is the question that oftentimes will come up about, do I have to have something going on to seek acupuncture? And I think, yeah, do I have to be broken in order to explore these services? And I think that's one of the beauties of the way we practice. The five element system is the way we were trained was to hold vision of who someone is in health as opposed to what's broken. I think that's what leads us to a lot of the life work that we do. So we did always stimulate some good conversation. But
That's
yeah,
always an interesting, like, shift for even our patients, I think, because the medical healthcare system in general is something's going on, something's wrong. And so if I do this thing, then I feel better. So it creates this probably a whole topic in itself, but this linear path of something's wrong, take this, and then I feel better. But that origin comes from something being wrong and broken, like you're saying. Whereas, and that doesn't mean that people aren't coming in with things that they want to feel better, but our role being able to sit with them and have this vision of who they are whole and healthy and moving them towards that. But there's also a lot of like snow clouds. You're right. Not even going to
we'll
do this, but I
we'll
do.
have to plow out
Oh goodness gracious.
Montana.
I feel
uh,
like this is going better than last time, but also
we
we
got
got a
started quick.
microphone
We
faster.
got started quick. We got new microphones too, so I think they're working well. We'll find out. Um, no, it's interesting because I think as a society, we are always trying to fix things that feel like they're broken. And absolutely, our goal also is, or if there are things that are, if there are things that can't fix the plows, if there are things that are not functioning in the body, how do we help the body restore order so that things don't hurt anymore, or the digestion improves, or your sleep improves, or your energy improves? So, in some aspect of that, I suppose you could say that's also about fixing what's broken, but we just look at it from a different perspective. And even once we've restored things, the goal is to get you to a place where you're healthy. And then how do we keep you healthy? And what's beyond healthy? What's thriving look like? What does feeling like your best self look like? And so we're not always just trying to patch things up. It's like, I've used the quote a lot here recently with folks who come in around the idea of not waiting till you're thirsty to dig a well. How do we get ahead of things and make sure the body's functioning and the way it's intended to function and things are balanced and we are living the lives we want to live. So, yeah, so it goes beyond just fixing what's broke.
It's also this may be too much too fast, but even helping people connect with that place inside of them that doesn't feel like something needs fixed. It's interesting. I have a few different people that I work with or have worked with over the years that feel like they have to have something wrong with them every time they come in, and asking the question of how we're doing or how the week's been or how the last couple weeks have been, and to watch some unsettledness around not having something wrong and that being weird is also interesting because it is we're just in that, like, seeking place of it's just how we connect with our health and our life is, "Okay, it needs to be better," but better also means something's wrong, and what if better was more from a place of improvement and refinement rather than lack of wholeness? So, that's, more of a philosophical direction, but it is, I think, yeah, it is tricky when we're just trained and primed for, finding something that's wrong so that we can fix it.
There's some of my, yeah, I love the idea of the messaging around optimizing health. And we see it a lot of times with folks who are coming in, even with some of our pain people who are coming in for shoulder pain or knee pain or some hip pain, and they want to try this before they have the surgery that the doctors are telling them they need to have. And even for those folks who still end up having to need surgery because it was more structural, it's always neat when those folks come back and they heal so much faster. Their doctors are surprised that they're not on the pain meds that they were on, that they were typically on after a procedure. And I think all of that can be chalked up to the work we've done prior to that surgery or that whatever procedure was, so that we've just got things optimized in a way that the body will, if we're, is, will get out of the way, will heal itself if we put the right things in motion. So it's an interesting concept, I think, for people when they think about their health because we are so reactive to what's going on in our
It's
bodies,
like a
especially as we age. One of the things that we hear a lot that is always fascinating, um, is around, oh, I went to the doctor and I said, this is just normal because I'm getting older. And like, maybe, but what if it wasn't normal? And what if you didn't have to deal with that pain that's bothering your just not sleeping well, those sorts of things. But
yeah,
optimizing health is a nice way to think about it because we always make the joke around the side effects of the work we do is usually improved energy, improved mood, improved digestion, and improved sleep. Even as the body shifts and comes back into order, those are the things we just expect those things to regulate as we're working with someone. And yeah, obviously we're working on your pain or whatever else is going on, but that chalks itself up to the idea of things getting optimized.
yeah. I want to revisit the original question topic of do I have to have something wrong with me in order to come in and seek treatment? And the answer being no. It's that initial reaction is always interesting because it's our default or assumption isn't I probably catch myself chuckling when I say it to people is, "Oh, there may be actually more going on there than you think there is going on." Too, when we do the paperwork and they check the boxes, there's this sense of normalcy of "Well, my digestion's fine, but I can't not take my probiotics and I have to take whatever that is, the herbs and the supplements and all of the things to keep myself in normal. But if we don't take them, we're a wreck, right? It's like, what if that didn't have to be your normal? So there is that category of person who there may actually be things there that we can optimize even though you don't see them as a problem thing in your life because you're so used to just navigating them and working around it. And then there's the other category of person that's great, enjoy being healthy, and yeah, how do we make sure that we keep you healthy and keep you feeling great? And like you were saying, the water thing, right? That's not in my language for patients, so I don't have but yeah, you don't wanna have to need it. It's better to, yeah, just not have to, like, tap into that. But it is also where we get into a lot of the life work that we do of just, okay, yeah, how's stress? What are your goals? Do you have dreams? Do you have the ability to create a vision for yourself of what's next? Or are we just, we're happy and healthy and going through the motions, but there's no direction or whatever that may be. And so sometimes that stuff comes out through those conversations too of, again, not trying to fix anything, but it's, oh, well, yeah, I haven't really, I just, this is life. I feel good. It's fine. So that creates some different direction as well.
Where are the places I feel stuck?
Mm. Yeah.
Yeah. Sorry, I had a passcode come up on my screen in my password
Making my editing harder for this.
there.
We are editing harder.
It's
Yep.
the idea of aging is interesting, and some people start to notice things as they get older. Some people know they're getting older, and they want to make sure that those things don't pop up on them. We're seeing it in the gym too. We're getting a demographic that is a little older with some of our folks, and it's neat to watch those sort of folks find more strength and restoring some balance and getting a little stronger and doing all those sorts of things to keep them healthier and thriving. We do the same work in the treatment room with how do we keep things at bay? How do we keep helping you feel like you're getting the things done in life that you want to do? How you help you feel like you can do all the things you want to do and you're feeling good and you've got enough energy and you're strong enough and we're not just sitting back watching things. The word deteriorate sounds terrible, but age and like that. I mean, it's catching up with all of us. And how do we? And yeah, how do we with those folks that everything is fine, but you're on? I had a patient one time that was on 5 blood pressure medicines, and when I asked about the blood pressure, they're like, "Oh, it's fine. It's good. It's regulated. It's regulated, but you're on 5 meds,
Mhm.
and that's okay. I'm not gonna push the envelope of getting you off of them, but also what's going on in the system that you need that much medication to keep your blood
What
pressure in
if
check?
fine could be better?
Or what about the anxiety medications? Or what about the melatonin? Or what about the probiotics? Or what about the digestive enzymes? Those are all like I don't have anything against the supplement world. We don't use a lot of supplements, but there are some things we need. But if we need them and whether they become a crutch, it's also something that it's also a sign that there's something off in the system that is not functioning like it should. And all of the food sensitivities and allergies and all of that sort of stuff in the world that we're dealing with as a society these days, they're all signs and symptoms that something's not functioning at its best. And what if we could regulate things and help the body function better and all of that? That's it's yeah, not that I'm making stuff up when you come in here.
Well, I think that
It's
goes back to the conversation of the intention isn't to find something that's wrong and be like, "Oh, you're not as, it's never, not as healthy as you think you are." But it is, uh, the word reactive you used earlier is perfect, right? Because then we just get used to layering these things in, and it keeps that one piece where it needs to be, and then something else wobbles out, and we find that next. And it is usually over the counter, like herbs or supplements that just, oh, this keeps it in line. And then the next thing you know, even if you're not on any medications, you're on five, six, seven different supplements or herbs to hold things there. And I know when we get patients on herbs, that conversation is always, look, these are intended to support your treatments and guide you back to that equilibrium. And when we get there, hopefully we have the option of coming off of them. And if you want to get off of them, or we're in a place of like maintenance and just constitutional support. But if they go away, like your world's not falling apart without them. That means that we've hit that corrective phase versus, because we don't want them holding things together either. Otherwise, we're doing the same thing with a different tool. So I think it's interesting. It's always a interesting conversation there of, it's don't not take the thing if it is making you feel good. And yeah, what if we got you to a place where I had somebody recently that I think the language that I used with them was like, I want you to be in a place where you feel like you have the option of taking those things, because if you forget, again, your world doesn't fall apart, but you want to take them as prevention and maintenance, not because you have to. And when you get to that place where, yeah, you just forget or realize you don't need it, right? That's a cool place to be in. Yeah, and that's always tricky because everyone's so unique in that. But that is the goal. We joke with new patients all the time. The goal is for you to not need us, right? The acupuncture works the same way. Is we start seeing you off weekly and building some momentum, but if things are working and you're feeling great, then we're getting you to every other week, every 3 weeks, and maintenance looks different for everyone based on their goals, but it isn't our intention for you to need us in order to hold things together.
I think that's a key point because, and maintenance is an interesting word too, because I've had patients where whether you're coming in for pain or whatever it is, we resolve what you come in for.
Mhm.
And my expectation, unless there's something going on systemically that is out of our control, I expect those things to remain resolved unless there's something lifestyle wise that is just causing problems. If you're in a position where your kidneys are suffering and failing, and I've had patients in the past where we do our work to help maintain kidney health so that they're keeping dialysis or something like that at bay. You're going to need me for a while, probably, and the herbs, because that's just part of the process you're going through. But if you've got back pain or you've got something going on that we can resolve, my our hope is to resolve it, and then how do we keep it at bay? And maybe it's maintenance, maybe you don't need that maintenance, maybe you've got the feeling so good that you just want to stick around and continue
Mhm.
because you feel good,
Yeah.
and this makes you feel good, and you feel healthy, and you feel you get more energy, and you're sleeping well, and maybe you've felt better than you've felt in years, and you just want to stay connected to the process. And there's absolutely work we can do there. I don't ever want to approach something from a place of, hey, if you stop doing this, if you stop coming to see me, all your stuff is going to come back.
Yeah.
And I think that's the beauty of how we practice. I think that's the beauty of some of the five element approach, or at least the way we were trained within that system, and some of the classical stuff we've learned as well, is that our goal is not to make you dependent on us. If you're if you stay connected to us, it's because you feel so good and you just want to stay in that space. It's not because if we stop that it's all going to come back.
Yeah.
And
And it is a concern.
yeah,
I
absolutely.
think I've heard it. I've probably heard that conversation more since we've moved to Montana than when we were in South Carolina. I remember hearing it a little bit there, but I think because we're in such a small area and there's less of it here or less exposure to it, what most people have is either a previous experience or a story of a friend or a family member who has done treatment somewhere else, right? Even outside of the area. I've got a couple patients who have family members in like California. Sorry, I had to mention it. And like Arizona, places where it's just more prevalent in the area, and they're like, "Oh, so and so loves it, but they can't not have it," or, "I don't wanna get hooked on it," and that's not a judgment on whoever they're seeing, and there's no backstory there, like, you don't know starting line to where we're at, but yeah, that isn't the goal, and it is a concern that comes in of, "I don't wanna start start because then I'm gonna need it, and I don't know. I don't wanna do this forever," and it's good, I don't want you to do this forever either unless you just wanna be around and you're welcome to stay around and be around, and I think that's one thing that's super cool about how we practice and the different
Methodology.
tracks we get into with people is we've seen, you know, especially in South Carolina, 'cause we were there for almost 8 years, so we had people that were around 5, 6, 7 years of our journey there, and we got to experience different phases of their lives from when they first come in and had that initial thing that they wanted help with. And then, yeah, they stuck around and maybe entered a little bit more of a maintenance mode, but then life happens or something comes up and you're supporting them in different ways through different stages. And it really speaks to just the dynamics of life in general, right? And you get to see them go off and make different choices. We had some people that moved. We had people that started a business or took the job that they never thought they were gonna take or and it's a really cool aspect, I think, of our medicine, and that I hate using the word holistic because it's such a overused word, I think, in medicine now, which is probably its own episode at some point. At some point,
Certainly, it's on that.
uh, you know, what does that even mean? beyond just throwing it out there and whole person wellness, but getting to see different stages of people's lives and the complexity of all of it is super cool. I don't even know how I got there, but
I think one of the important, I think one thing, I think a lot of people, we do a lot of work in with mental emotional health, even for folks who come in for something else. When they start feeling better emotionally, or their anxiety is reduced, their stress levels are down, there's just something about that when they start discovering joy. Like when the lights come back on and they're just happier and they just feel better. I think that's probably something that keeps people connected to us, even though they originally came in for some knee pain.
yeah,
And it doesn't mean that you come in for knee pain and we're going to get into all your, we're not, we're not going to tell you it's all that. And we may not even talk about it, but the process we go through as we work. Again, if you're restoring how the body's intended to function, like it's not intended to have all the anxiety and all the stress and all of the worries that we have in day to day life. But your knee starts feeling better, but also you start sleeping better. Your mood improves. I tell a story of a wife who was coming in and she talked about how much nicer her husband was getting on some of the herbs and some of the treatments. And the joke was like, you're not supposed to be giving him the herbs. And she said, I'm not. But just handling the day to day stuff and just feeling good in ourselves, I think is one reason people stay connected after things have healed. Like my background is in massage. If you come in with back pain, I'm going to give you a good massage. You're going to feel good, maybe for a week, maybe for 2 weeks. But unless, especially if it's happened at work or you've done something to wreck your back or that's just what your life looks like, you're going to need me again. The beauty of some of this work is we've been able to graduate people from
yeah.
the pain because things are moving and circulating and are better. Now that doesn't mean if you go out and don't go out, if you go out and wreck your back again, there's some lifestyle pieces of that. But the how things hold with some of that is always so impressive and how I don't need to see again unless you do something to your back. Now, if you're feeling good and you're just feeling better and you want to stay connected, absolutely, let's stay connected because I'm all here for that too. Because ultimately, we want people living their best lives, and if that usually includes not having the anxiety and the stress and the all of the things that are the stuckness in our lives. So,
One thing
but
we see happen too is the layers of all of it, the layers of the work, but also the layers of their symptoms or the things that they're experiencing. If a lot of people, the physical things that people are dealing with, depending on how chronic or how long they've been dealing with it, becomes its own identity in a way. Like it's how we're used to showing up in the world is like, oh, like I can't do this thing because my knees always hurt. And so this just becomes this we just become resigned, I think, to that's just how it is. The aging thing is such a conversation. It's just, "Oh, I'm old. I'm getting older." And we just chalk it up, and there's a part of you that doesn't want to people, right? Like, they either just accept it and become flattened by that realization, or then you've got the other ones that are feisty and are, "Don't tell me I'm old, like, I can still do all of these things." But when those symptoms start to feel better, then it's like the world opens up in a different way as well. Because it's, "Oh, yeah, I've always been told that this was just something that I'm gonna have to deal with, and it's gone, so what else can feel better?" And there may not be anything else that feels bad, but it creates this I think our last conversation was around the question and curiosity, and I think that can be really powerful for people too. And it's just that overlap of things is interesting, and sometimes there's other symptoms behind that one symptom, right? Like, that one thing that's just front and center that's screaming to be able to take that off the table. It's, "Oh, yeah, maybe I don't sleep as well as I thought I did. Yeah, let's keep going. Let's see if that can be better." So that's always an interesting piece to watch happen for people too, is just the kinda ticking away at all of those things. But
I think we get used to our normals,
yeah,
and our normal is our normal, and that's fine. And it just becomes how we live our lives, and we don't realize. But what if that wasn't your normal?
yeah.
What if it could be different? What if it could feel better? And what if you didn't have to be resigned to this is just the way it is?
We've had that with even a couple patients who have needed surgeries, right? That's such a our healthcare system is such in a challenging state right now where I think we see the extremes is like people are either worried about coming here and us judging them for still being part of conventional medicine, or they're very anti that altogether. And the anti is interesting because I've had a couple people over the years that just they don't want to have the surgery and they're so stubborn about all of the things. And that is when like structure is structure. If it's broken, torn, it is what it is, right? You have a different choice in front of you. If you're okay and happy with the quality of life that you have, then great. And what if there are things that we can do to support you through that and get to a place where you do decide to pull the trigger on it? And what if that is the thing
Yeah.
that gives you your quality of life back? But the surgical stuff is just a fascinating, like, corner of our practice that I don't think we also anticipated having. But seeing people go through that process and recover and be on the other side and get back to doing things that they couldn't do before, or shouldn't have been doing before is also fascinating. So sometimes that's a role we play too.
I think it's interesting because we do get both extremes of that. There's a level of that, and I don't really have a vote in it. I'm here to support you and whatever your process is, and if you don't want any part of that system, I can. I'm not going to sit and put the system down with you, and I will still advise you where I think where you need to be advised. But I'm also not going to talk you out of your belief system either. Same with if you're. I'm also not going to tell you that all the medications and all the things you're taking and all the things your doctors are doing for you bad either. This is about your process and what we how can I support you where you are? And if that means we can sit and talk, we're educated enough to sit and talk to you about your medications, but I'm never going to tell you they're evil. And I can help you that conversation you want to have with your doctor. And I will also be there to have conversations with you if you're absolutely anti the Western side. That there may be moments where
This is one of those moments.
you need a different conversation, and
Yeah.
I think that's where the beauty of the way we practice too, the rapport and the trust that's developed between us and our patients, because we can have those honest conversations without feeling like we're trying to influence you one way or the other. I just really want you to be informed and advocate for yourself, and we'll go down the rabbit holes, and we got enough resources and folks that we can, yeah, we have our opinions, but at the same time, it doesn't really matter what we think. It matters what you're looking for and what your goals are, and how do we help you?
At the end of the day, you have to be behind your choices
Yeah,
that you're making for yourself, one direction or the other.
yeah,
If you move forward, great, and if you don't, there's gonna be consequences isn't the right word, right? But
yeah.
it's there's gonna be some experience you're having on the other side of that, regardless of which path you choose, and you've just gotta be okay with it. The advocacy is such a piece. I know when we were both getting our doctorates, that was one of the couple of the classes that we had were about how to integrate into like Western medicine and how what is our role within that. And there was a big conversation about just helping patients advocate for themselves. Like it's not our job to push them in one direction or the other, but help them feel empowered enough to your team should support you no matter who it is, whether that's primary care, chiropractor, PT, acupuncturist, coach, trainer, whatever that is. Everybody should be pulling in the same direction, but they should also be like, this is about you and what you need and want and all of those things. And if you don't feel like you can have those conversations, then those are
I think that's the big piece. That's when we talk about advocacy. The one of the my main point I usually have with patients when we're talking about that is, and we talk about the team is just make sure you can have a conversation with them.
mm,
If you don't feel like you can sit and have a conversation with your provider, regardless of who that provider is, and they're just dictating to you how it should go. Now, I'm not saying they always have to agree with you,
yeah,
but you should be able to have a conversation with someone that can give you some listen to you and have an honest conversation and also support whatever decision you make. I've worked with patients who their providers fired them because they refused to do what the provider wanted them to do. And I think they were probably better off without them. They landed with providers that were, I don't want to use the word caring, but they We're a little more open to conversations. And at the same time, if we're having a conversation, I'm also going to share with you that if you may not always like what we have to say,
Mhm.
but I'm also going to support you in whatever decision or path forward. And I think your doctor should be the same way. Anybody on your care team should be the same way. Because if you're scared to have a conversation with your doctor, you don't feel like you can have a conversation, or you don't have time, which is a real problem in the system these days, is you only get 5, 10 minutes. How can you possibly listen to someone in that amount of time and hear them and actually hear them and help them make decisions and not just running them through a mill? And I think more than anything else, if you're gonna help your patients advocate for themselves, that's it right there. That's the piece of advice is if you don't feel like you can have a conversation and you don't feel heard, then maybe you should reevaluate who's on your team, because your care team should be on your team. They should be working with you and for you, and they should keep your goals in mind and what you're looking for.
Like you said, at least entertaining the conversation. 'Cause it's such a we're all educated, right, in our own way, and we all chose our specialties in our field and all of the things because we think that's the best path forward. I wouldn't be doing this work if I didn't think that this was the thing that was gonna help people, and everyone else feels the same way in their own field. They're in it for a reason, and they've studied, and they're there, and they're practicing. And sometimes it's easy to get lost, and the day for us is what, like 8 patients, 9 patients. But if you're seeing more than that, you just get used to show up, check the box, shake hands, do the thing, run through the report, and forgetting that the person in front of you, like, their questions are valid and they're real and all of those things. And we have people that come in and they've Googled, right? Like, we joke about Dr. Google, and they come in with information. And we are grateful to have the time and space. And that's just how we've set up our practice to be able to create opportunities for those conversations. And can't do that in 5 minutes. There's probably I've had patients that go in and check in and have a concern that they found wrong or indifferent through the internet, and you try to bring it up and it just gets shut down because it's, "Oh, you think you know more," whatever that is that happens inside their heads. But and at the end of the day, your concerns are they're real. Your experience and Googling anyways, make sure you have the right team to meet your needs for who you are as a person too.
I would also, it's funny you bring up Dr. Google, because I also believe that if we as practitioners spend that time with our patients, or are allowed to spend that time with our patients, I think patients probably feel less of a need to Google so much, because it's just, you're really, you're not feeling well and you're desperate and you're trying to understand and you want to know what's going on and you want to know what these lab tests mean and you want to know what these symptoms mean. And if I can't check in and talk to and have an honest conversation with my provider, then the next best thing is to go ask Dr. Google. And even when we spend time, we still have patients who ask Dr. Google. But but we've also developed enough time and rapport to know that taking the time to listen to their concerns. And yeah, this might be the 100th person this week that come in after talking to Dr. Google. And as a practitioner, you may be frustrated about it. But this person in front of you, this is the only time they've had with you this week. They don't know that everybody asks Dr. Google when you come in, and you might get frustrated, but at the end of the day, you don't get to be frustrated. Like, this is a human in front of you. This is a person who's concerned about what they're going through, and they're trying to find answers. So I love the fact that we get to sit and take time to provide and talk through things. I have all the answers,
Yeah.
and if I don't have them, we'll go find them. And
We're really good. It's tricky because there's not a lot of information out there, not a lot of good credible information out there within how we practice, which makes it tricky because when people do go down the rabbit hole and start looking for understanding with Chinese medicine, right? Like, a lot of times the sources that they're getting to may not be the best route. But I've had people that I've shared some of our online herbal resources with, and I'm like, hey, like, you're gonna end up on this page It's probably a lot more jargon than you need, but it's a resource that we trust. And so if you're gonna look here and take that information in, and then as you have more questions, bring them back and I can help you decipher between that, which is different than just Googling an herb, seeing what comes up and being down the entire rabbit hole of all things that are out there right now. I think I see it a lot more probably with herbs than I do with the acupuncture side. But yeah,
Well, there's a lot of well, to get into the herb talk. Um, the Chinese herbs are different. It's not like you go to the grocery store or you go on Amazon and you order something and it's
you're gonna pick on Billy the Box Boy.
no, I wasn't even gonna say it. I was
Billy the
trying not
Box Boy
to.
is not a real person either, by the
Billy the
way.
Box Boy is not a real
Well,
person.
not
But you end up in a grocery store and someone who's stocking shelves, and I always use the term Billy the Box Boy. And he doesn't have as much education with the use of the herbs as someone who's actually studied the herbs. And maybe it's a good herb. It's ashwagandha is a good example. Ashwagandha is a wonderful herb, but ashwagandha is not a herb for everybody. In Chinese medicine, we use them in formulas. So there may be 12 to 15 to however many ingredients in a formula. And if you go home and search all 12 ingredients, you may learn something about one of the herbs that doesn't make any sense to you because that's not what you have going on. But you also don't understand that it's in there to play a very specific note within the harmony of that formula. It may just be there just to harmonize the formula. And it may not make sense to us when we Google it and we look it up, but it's in there for a reason and and it may play a completely different note in a different song in a different formula based on who we're customizing for and who we're trying and what we're trying to do with the herbs.
dosage.
Dosages, everything. It may be the chief herb, it may be the one in charge, it may just be playing a really small supporting role in a formula, and that matters as to what it does in the formula. So, it's not as easy as just going pulling something off the shelf for this particular symptom, and that's part of what the training's for, that's part of the experience is for, and this is the reason our patients the formulas change from week to week based on what they're going through and how they're responding and how much health is being restored and all of those sorts of things. So it's not as simple as they always get that talk.
Yeah.
We send home a formula is like, here, I'm going to give you these ingredients
You're gonna
and
Google
you're
'em.
you're going to go home and Google them. I know you are.
Yeah.
But before you go down any rabbit holes with them, just come back and ask me because I'm happy to sit with you and explain to you why that herb is in there and the role it's trying to play and why it may not make sense to you, but why it makes perfect sense to me and how it's going to help you through this process. But that only happens if you have experience with the patient and they trust that they can come back and ask questions. And if they don't, they're not going to trust you and they're going to go down other rabbit holes that may lead them to places that don't necessarily align with truth for one, what it's actually doing, but also just because your neighbor used it doesn't mean it's good for you.
Yeah.
Those sorts of things. So
Because your symptoms are the same
yeah,
doesn't
yeah.
mean that even if your experiences are identical, you're 2 different people.
We have the tea shop and we have a few over the counter herbs on the shelf, but even those, even though they're set up and they're safe and they're good for the remedies and stuff that we've created, there are still some people that come in that like, we still have a little bit of a chat and make sure, this is probably not the right thing for you. Because yeah, it says cough on the thing, but there's 4 different types of cough formulas on the shelf because what's your cough like? So
We had
those sorts of things.
somebody recently with some digestive stuff, and we have 2 formulas that we feel pretty confident with for over the counter with digestion things, and then through more conversation, there was an element of pain that was happening, and I was like, "The moment we go there, I need to see you as a patient." Pain is one of those things where we just can't if we move something and it's more stuck than we realized, or it's just yeah, it's
pulling on a thread
that
that we need to know more.
yeah.
We need to know more about.
Yeah, and that's been an interesting journey since we
Yeah.
got out here because we've always been adamant about have to work with us as a patient, have to work with us as a patient, and we when we moved out here because of our technically it was our second shop on Main Street, there was so much curiosity and interest in the area for the herbs, and so we went back and forth of, "Man, are there things that we could give over the counter?" Like, even in small doses, we, joke about the powders and tinctures. We essentially microdose them for patients, so we don't even give a full heavy hitter, just enough to nudge the conversation in the direction that we think will be helpful and therapeutic. But it was we went back and forth for, I don't know, probably 3 or 4 months before we even pulled the trigger on our first couple formulas because we wanted to make sure we were comfortable with those edges and boundaries and where the hard no's are, and it's
It's
there's
always
there's
interesting.
one out here, but
Yeah.
different.
It's interesting too because it always feels I'm not trying to sell you acupuncture in those moments. I'm just trying to make sure you're getting taken care of. And I don't want to sell you something off the over the counter just for the sake of selling you something that may not be right. And I especially we don't have anything over the counter that's going to harm you. But I also, if this isn't going to do it for you because I need more information, I know that formula is not on the shelf, and we would need to customize something. But
It's been a cool relationship that we've built with the community here too, because I
yeah,
think we've been so steady with holding that line that when people come in and we say that we can't, they trust us and believe us in that, which is that was the goal, right? It's not feeling like we were trying to bait and switch people into the treatment room or these big workups, different conversation for another day. Like the goal isn't for you to walk out of here with bags and bags of supplements and just really rack up a bill for you to get that thing taken care of. If we have something, we would gladly give it. Sometimes we have teas, right? Teas versus the tinctures, which is like another price point. But it's cool to have that experience of telling people no, they shouldn't have something and that like reflection back of, oh, you can tell that they know we're looking out for them and not just trying to sell them another product or sell them another thing. It's if we don't have it, we don't have it. We're not going to try to make it up in order to make it happen. I had that happen this past weekend. We did a couple teas and a tincture. And I think it was the Evil Bone water. It was a topical. And then we got into a tincture and I was like, honestly, I just don't think it's a good idea. And they were like, "Okay, cool. I'll just take the tea and the Evil Bone water then." And it's nice to be able to tell them that, but also, like, when you come back, you can trust what we're saying, which just starts that relationship in a different way.
the tea really has been neat for that because we've got a wonderful support inspiration.
Yeah.
Inspiration is what the lungs are for. It's well named for the you come in with a cough or something going with your lungs. Let's sell you some tea. $7 for an entry point. Try an ounce of it. If it doesn't work, I've certainly got some tinctures that can be more helpful and a variety of things for especially with all the things going on right now with seems lung related. We got a dry lung, we got a weak lung, we got phlegm in your lung, we got what do you need? I got 5 different tinctures.
It's like the
We're
4
working
boom.
we're, we're gonna have to have a conversation. But let's try the tea. If the tea don't work, come back and see me. I've got some herbs for you.
Yeah.
And if you get on the other side of it and you just feel like you didn't recover, then we get you in a treatment room and we can help you recover from that too. But it's always about how can we meet you where you are? And if you want something more aggressive from the beginning, then absolutely. Let's dig into the herbs. And maybe we may even ask you to stick out your tongue and let us feel your pulses. But here we are. But it is neat to be able to take care of people
Yeah.
in that setting. That's what Fridays and Saturdays around here are about, anyways. It's fun for us to be around and meet the public and
Yeah.
do the things. And
Make it a little less
yeah,
scary for people.
yeah.
Chinese medicine is such a yeah, depending on people's experiences and exposure with it. There's a lot of transplants where we are too, so I think that helps. People that have moved in from other areas have been exposed to it in different ways, but it is different.
There's so much nature here, and people like the idea of natural. There's that holistic word again. That, but they want to stick to the roots of things. I think one of the things I appreciate about how we practice is
Yeah.
we try to remain very traditional with the medicine and stay rooted in the classical approach to the medicine and not just
And we really won't go I don't know if this is gonna come across the way that I mean it, but we're really not gonna go out of our way to humor you either, right? I'm not gonna sell you something just because you want it. Or treatment room is another example. Like, we are very traditional in how we practice, and we see it a little bit with people wanting to come in and, like, dry needling or whatever that is, and we're still gonna do what we think we need to do for you to help you. We practice the way that we practice for a reason, and it's not robotic, it's very intentional, and we don't have the electrodes or any of those things, and it's just maybe you've had it elsewhere and found it effective, and that's cool, but I believe in my tools and our approach, so it's also different conversation piece. I've found myself here I think I've had more people that have been exposed to acupuncture before, even not just necessarily in the area, but just in their history, and I find myself here asking them more about their experience of that because it is the westernization of our medicine is just becoming more and more prevalent, and it is what most people have been exposed to. Lots of needles or different needling styles or the different gadgets and gizmos and all of the things. So it's having that point of reference. I'm like, okay, that's cool. Just so you know, like, we're gonna probably do 4 or 5 needles, and it's you're coming in for shoulder pain, and it's probably not gonna be in your shoulder. So just be prepared for that, which opens up different dialogues, which is fun. You know, we love talking about it and educating people on it, but it is different. And we've one of the jokes we've had over the last couple of years is as unique as our style is for culture, our Western culture, I think we're realizing we've also taken our own approach within the unique approach of classical acupuncture, and it's not just even 5 element anymore, it's just how we practice, which is interesting.
we've definitely stretched the boundaries of what we studied in school. It was classical 5 element acupuncture, Worsley acupuncture. I'm definitely not I'm definitely not a purist to toe the line to that because the teachers that I've studied with are just they all have something to offer.
Yeah,
I do seek out teachers that are more classical in their approaches. The modernization of the medicine and the westernization of the medicine to me feels like they're replacing a prescription of medications with a prescription of needles. And we just don't get on board with one size fits all. We've talked about it a lot about migraines, for example. We've treated a lot of migraines, and there are absolutely prescriptions of acupuncture points for migraines. And we really haven't come across migraines that we haven't been able to resolve for people. But I've never treated one the same way
yeah,
because people are unique. You know, sitting and listening and talking and getting to know and hearing their concerns and figuring out who they are in health. I think this is going to wrap up the whole conversation. Who they are in health and what they've been through and what's led them to where they are and where the headaches are stemming from. Um, Everybody needs something different. There might be some commonalities between some of the points. This is a unique medicine that's really it is based on what's going on with you and how to restore balance in your body based on the climate that exists and how to those the climate should be different for your neighbor
yeah,
and you're just not the same people and you've been through different things and it's neat to get to know people and understand people and figure out what those puzzles are that we can where we can unlock things and free things up and resolve some of those things that I've had patients that have been dealing with headaches for 15
mm,
years. I've a nurse back in South Carolina, 15 years. She tried everything. She'd been everywhere. And the only thing she really said to me is, I don't want to know how this works because I won't believe it. And I'll poke holes in the theory. And it wasn't until she hadn't had a migraine for 3 months where she was like, what in the world is this all about? And we had great conversations.
yeah,
And then we got into the life stuff and the things that were going on in our world that were probably related to where the headaches were stemming from. But yeah, it's really neat to help people find that kind of relief. And maybe it's not 15 years, maybe it's just Maybe they're just starting, but and it's that way for everything. It's beyond headaches. It's sleep and digestion and yeah, all kinds of
Hormones are
hormones. Absolutely.
such a thing.
The women's health stuff is periods. You're not
Menopause.
supposed to you're not supposed to have pain around your period. You're not supposed to be moody. You're not supposed to all the things that we every person in my life that I've ever known that had a cycle once a month has had some sort of disturbance in that cycle. I didn't know that was not healthy until I went to acupuncture school and learned it. Oh, that shouldn't be that way.
Yeah.
And yeah, absolutely menopause or perimenopause and hot flashes and night sweats and all of the things that come with that. This medicine is amazing for those types of things, but they all need something specific for their needs. There's not anything that I'm going to pull off the shelf and say, here, this is the secret bullet
Yeah.
and it's going to solve this for you. Like this work we have to do. Yeah. Mhm. But that's, so we get some of those workshops coming.
Yeah.
We're working on some, what's the word I'm looking for? Postpartum,
Yeah.
some stuff there. We're working on some women's health stuff for the menopause, perimenopause, and how do we make that easy?
Yes.
Whether it's some herbal stuff with some talks and some wisdom we can share from our world.
Autoimmune diseases are another one that I think is interesting to draw just some attention to that we work with because I think those are we talked about pain, sleep, digestion, those types of things, but the autoimmune stuff is usually it's complex, but it's also it's super complex in the Western world too, and it's just become this thing of you're having this experience, we don't actually know what's going on, so let's slap the autoimmune label on it. But we have pretty good success with those types of things as well. The I don't know if we wanna make a hard statement of it usually overlaps with some of the life work, but a lot of times that it does, it's just the body holding on to things that it's been through and gone through, and it's tucked away and creating this systemic fight or reaction or whatever that may be. But I think that's one that a lot of people a lot of times when by the time they make it into us, they feel they've lost a little bit of hope around that resolving because it's just that is the thing that the doctors have told them, "You're just gonna be dealing with this the rest of your life, it's autoimmune." And so that one's always an interesting one too. But
And there's the signs and symptoms that are going on with
yeah.
is it's obvious that there's something out of balance. There's some things that need to be restored. So yeah, the acupuncture, the Chinese medicine is fantastic for it.
I always tell people if you're having an experience of something, chances are we can help. And that makes it really broad and oh, but it keeps it from I think when we're our culture is so quick, like we want the labels and sometimes we need them, right? But we also see a lot of people that are just like, I've been everywhere, I've had all the tests run, they can't figure out what's going on. And that's tricky because there's no label at all, which I think that's why I shifted my language to if you're having an experience. You don't need a diagnosis of something in order for us to be helpful, which I think is also important to say.
We're going to do our own diagnosis.
Yeah.
Our approach and the lenses we look through is completely different because even if you have a label, like your experience of that condition may be different from this other person's
Mm.
experience of that exact same condition.
Yeah.
And as we break it down and really dig into things, again, it's down to back to the individualized approach.
Mhm.
And that's true for a lot of things. And yeah, I know the labels are helpful for some people, especially when they've been dealing with things for so long. But just because you don't have a label doesn't always mean there's an answer either.
Yeah. I've had people ask before if they're actively seeking out other tests and all of those things. Or like, do I need to wait until I have those results and those answers before I can come see you? And I'm like, no, just come in because we can start working with it. And yeah.
I think we touched on this last time we talked was around our approach usually has more to do with the questions that we ask than the answers that we have.
Yeah.
Getting in and really investigating and figuring out what's going on is more valuable than again, I think it's about the time that we take because if I have all the answers, the appointment should only take 5 minutes, right? If you come in and tell me what's going on, I can immediately tell you what's wrong with you. I haven't really taken the time. to get to know what's really going on with you. But also, I've got more questions. That's why we need to talk longer. I want to know what your experience of this is and how are you experiencing this condition and when is it better? When is it worse? When did it start? What's going on in your life? Like all of those sorts of things. But really getting to know you so we can come up with a plan that can restore health. Yeah.
Cool.
So
Well, once we got rolling, that was smooth start.